All right. Hello, everyone, and welcome back. And thank you for joining the Wisconsin Coalition for Social Connections Social Connection Awareness Week Summit Day 3 today. Again, my name is Suzanne Morley. I'm a health promotion program coordinator at the Wisconsin Institute for Healthy Aging, and I also coordinate the statewide Wisconsin Coalition for Social Connection. So today's conversation is all about coalitions and community building and nurturing connections with community members and partners. And we are going to do some of that as well today towards the end of today's webinar and allow some time for you all to connect with each other. So just a few housekeeping pieces. As usual, all participants will remain muted and have their cameras off during the presentations. If you would like to access the live captioning, please click on the CC icon on the bottom toolbar of your screen. This webinar is being recorded and an email will be sent out to all of the registered participants after the presentation. Again, I encourage everyone to introduce yourself in the chat with your name, your organization, if you're attending as part of an organization, and your go-to place in your community to socialize. So I'll leave a little space here for those introductions. My go-to place in my community, so I live in Adams County, Wisconsin. It's somewhat central to the state. And we have some really cool local coffee shops here that I enjoy going to and taking my son to. And there's one that's right by our local farmers market. So that's always a fun place to go to. Wait to see some of those come in the chat. Farmers market and Pilates studio, Green Circle Trail. Oh, that's a good one. Local coffee shop. Another coffee shop. Local antique and crafting stores. That sounds fun. Like that. Go to area, downtown area with shops and restaurants. Farmers market. Library. Library is a good one. I've been working from the library the last couple of days and there's always been people there doing I think they were playing some card games yesterday and doing some crafts. So that's fun. German Shepherd Dog Club. Okay, I like that. Library or online. New coffee shop in a little village. That sounds fun. Restaurants, church, local parks. Awesome. Some great ways to socialize. Local kids sports events, libraries, coffee shops, farmers markets, local park. Awesome. Keep dropping those in the chat. Your introductions and your go-to places to socialize in your community. So today's agenda, we have Morgan Marler from the Foundation for Social Connection, who's going to talk through the action guide for building socially connected communities. We'll have a panel discussion today with some local coalitions throughout the state that are going to share about their work. We'll have some time for Q&A. We'll do some speed networking with our 5 for 5 connection challenge. So bringing that into our conversation and discussion for the day, and then we will wrap up. So many of us are probably familiar with or even a part of a local coalition or have been at one time. There are many different definitions of coalitions, though the general consensus is that a coalition kind of brings people together to work towards a common goal. So coalitions can do many things. They can raise awareness, provide education, engage in and advocate for policy or systems changes, hold events, collect data, and even more to overall make an impact to better their community. So before we jump into our conversations for today, Erin is going to launch our first poll. So the poll question here is, I know how to get started to build socially connected communities. Yes, no, or somewhat. So give some time for that. All right, maybe about 5 more seconds here. All right, so it looks like 24% of us yes, 16% no, and 60% somewhat. So excited to talk more about this and introduce Morgan Marler from the Foundation for Social Connection, who, like I said, is going to talk about the action guide for building socially connected communities as a starting point of coming together to make change. So Morgan, I will let you take it from here.
Thank you so much, Suzanne. I really appreciate it. And I'm so happy to be with all of you virtually. I was telling the panelists before I started that I've actually spent a little bit of time in Wisconsin, specifically in Plymouth, Wisconsin, with my great aunt on my husband's side. And I just remember feeling, we actually went to the Madison Farmers Market, which is like the number one farmers market in the world. And yeah, just really excited to be with you all today. Um, as Suzanne said, my name is Morgan Marler. I serve as the Associate Director for Network and Partnerships at the Foundation for Social Connection. And I'm going to share a little bit about who we are and what we do. But first, I want to get us started with a moment of connection. So this is just building on what Suzanne asked us to all put in the chat earlier. But my question is, what has been the most meaningful moment of community connection to you and why? I'm going to go ahead and put that in the chat and just take a moment to think about that and go ahead when you're ready and enter it into the chat. I'd love to see what a meaningful moment of connection, community connection to you and why has been. And I'm going to share mine first. Sharing a meal with a new neighbor. So we had some new neighbors come in to our neighborhood and we shared a meal with them. Diane said an intergenerational, multicultural gathering where the kids were having as much fun as the older adults. Amazing. Melissa said being a part of the Chip and Chana in partnership with the hospital. Suzanne said attending the Adams County Suicide Prevention Walk every year. It's incredible. Parks and Recreation departments having exercise classes, bringing time slips programs to our community and pairing young artists with elders, creating relationships and beautiful art. Anytime a community comes together to help a member or community family in need. These are awesome. Keep letting these come through. Um, so, as I said, I'm representing the Foundation for Social Connection. We're a nonprofit that's based in Washington, D.C., and our mission is to advance social connection nationwide, rooted in evidence for our collective well being. And we've been in operation since 2020. So, right before the pandemic, we started this work. We also have a sister organization, which is the Foundation for Social Connection Action Network, and that was started in 2018. So, we really have been focused on isolation and loneliness and social connection for the last kind of 6 years. And our work is really about translating research into practice and creating long lasting partnerships and convening opportunities for field builders such as yourself, and really prioritizing social connection as a national value powered by lived experiences. So I mentioned this kind of research to practice and really being rooted in evidence. So that comes from our Scientific Leadership Council, which is made up of 12 individuals. They're the leading experts on isolation, loneliness, and connection in the US, as well as our larger scientific network to make sure that we're really bringing the evidence into strategies and policies for greater connection. We also work with leaders across the county across the country, from the local all the way up to the national level, to really help develop and implement best practices tailored to communities and populations' needs. And we're really focused on building a vibrant society where social connection is at the heart of how we live. I'm going to talk about our action guide for building socially connected communities in just a moment. That's one of the tools and resources that we've developed, really informed by research. So I think that we're all kind of familiar with the impacts of isolation and loneliness. What we know is that the evidence is clear that isolation has really negative impacts on our physical, cognitive, mental, and economic health. And at the same time, socially connected communities are found to be healthier, safer, more resilient, inclusive, and more economically prosperous. These points are well documented within our action guide for building socially connected communities that we're going to be talking about today, as well as the Surgeon General's 2023 advisory on the healing effects of social connection. In addition to the data describing the magnitude of the problem that we face with isolation and loneliness, there's also resources that can help you paint a picture of connection and isolation where you live and work. I won't read all of the things on the screen, but this is just really to show that we know that social connection is a protective factor, and socially connected communities are healthier, more vibrant, and have just better well-being overall. So, over the years, the foundation and our network of partners have worked to advance social connection. And what we've found is that research and solutions focus more on the individual rather than the overarching structural issues that really impact communities and drive disconnection. Specifically, our various initiatives with community leaders and partners highlighted two critical points. So, in our work with leaders across the country, we really heard two things. First, that leaders from across the country see the importance of advancing social connectedness and belonging in their communities. So they really know that this matters. And two, that they are seeking guidance to take action to strengthen these qualities in their communities. So Suzanne put in the poll that this question of, do you know how, like, do you know where to start? Do you not know where to start? Are you somewhat sure where to start? And a lot of people that we've talked to over the last 6 years have said, I don't really know where to start. I know this is important. So to equip change makers, including government, officials, nonprofit leaders, and small business owners, as well as cross sector innovators, we created the Action Guide for Building Socially Connected Communities to provide practical support to advance social connection and belonging in communities. So, in order for community wide connectedness to occur, we believe that 7 conditions must be met, including changing community member and leader beliefs, addressing power dynamics and relationships, and addressing policy and environmental factors. You can find more information about our conditions for change, which is embedded on our homepage of the Action Guide, which I will drop a link in the chat shortly. But I think that it's important to kind of highlight the beliefs that we grounded both the design as well as the implementation of the action guide. So, our 3 beliefs that are up on the screen are: we believe that community members and local leaders are really the experts of their own communities, and they're the ones who can best determine the steps and courses of action to really suit their unique context. So, you all are the experts in the communities that you live in and really know how to make change and what is needed based on the experiences, the lived experiences of the folks that live in your community. The second belief is that an equity approach is critical for healthy social connection. So many historical wrongs, such as systemic racism, disinvestment, and disenfranchisement of communities, have led many to become fractured and traumatized. So we really aim to integrate an equity perspective in our approach by focusing on how the following central questions impact the work. Who has not been included in the conversation to date? Who is at most risk of disconnection? And what are the root causes that have contributed to our current condition of social connection? Our last belief that we kind of centered in the creation of the action guide is meaningful long-term change will only occur through collaboration, systems change strategies, and the inclusion of community members' perspectives. So one kind of important piece that is kind of represented in our conversation today is the presence of coalitions and collaborations between diverse partners, whether that's an individual or organizations. So, a little bit about the action guide. So, the action guide is a 6 step process or a framework, sometimes we say. These are meant to be somewhat linear, but we've had folks also jump in at different points. So, the steps are separated into 3 kind of sections. The first is about learning and preparing. The second is about planning and implementing. And then the last is about evaluating and growing. So the steps are reflect, which is all about reflecting on your community's current state of connection and connectivity. The second is about reviewing. So the drivers of disconnection, the vital role of social connection, and the state of connection in your community using our county level dashboard, which I'll show in a second. The third step is around collaborating. So, this is where our community listening session lives. And that's really a full blueprint of how to conduct a community listening session, specifically focused on social connection, isolation, and loneliness. And that's to include community members and helping identify what the issues are at play. And then there's also another section which I'll highlight around partnership mapping. So, who are the likely and unlikely partners in this work that can really strengthen the work as well as the implementation of whatever the plan is that your community decides to take on. Um, the fourth step is planning. So, this is where our community social connection workshop lives. And this is all about how do we move from talking about the thing to really addressing the thing. So, coming out of that, you would have a plan of what you would do, what the intervention you might engage in is. And there's an exercise kind of around how do we translate vision into goals into action. The fifth step is about evaluating. So the impact of your initiative is really important to figure out how are you going to measure it? What data collection are you going to use? What kind of questions are you going to ask? And how are you going to know what you're doing is really making an impact? So we have a tool specifically to help figure out how and what are you measuring and who is measuring it, and then also some tailored measurement practices and stakeholder engagement recommendations for meaningful and actionable insights. And then the sixth step is really about sharing. So I think there's a lot of pockets of incredible work going on across the country. And it's really important to share out kind of these bright spots and help other communities see themselves in this work. So we really prioritize how are you sharing with the broader community about the impact of your work? How does that help build and sustain impact over time? So we have a tool that we'll be launching in December around how do you communicate this to local community foundations to get more resources in the implementation and then also the sustained impact of your initiative. You'll notice on my slide, there's a couple icons on the left-hand side on the bottom. So throughout the action guide, which is a living, breathing website that is a kind of an interactive tool with all these steps, we have a couple of different icons that indicate different aspects of the guide. So the kind of left, kind of the map one is about action. So that represents an activity to complete. And we also have within the guide, um, activities that you complete actually on the website. And through some magic of the internet, I'm not exactly sure what it is, some kind of cache thing, it actually saves your answers for you. So it's almost like a journal where you can go to it, come back, revisit it. And then later, or I should say early next year, we'll be launching a printed version of the guide. So if you want to take it on the go with you, you'll have the ability to also have that. So I talked about the data dashboard. So this is in step two of the action guide, and this is at the county level. So the dashboard is meant to be kind of a snapshot of current state within your community or in your county. It is not like the whole picture. I think we all have worked with data that is either representative or not representative of our community experience. And so this is really to help kind of paint a broad picture and have you kind of engage in conversation about is this what we're experiencing in our community? And it also gives some perspective on where you might kind of engage in interventions. So the data dashboard is organized into three sections. The first is around individual indicators connectedness. So that's concepts relating to the social connection or disconnection of individuals. One of the data points that we have is about living alone. I think we all know that, there's our individuals in our lives that live alone that are experiencing isolation and loneliness. But there's also others in our lives that live alone and they live really fulfilled, very connected lives. So it's just really kind of an indicator. It's not a kind of correlation between those who live alone and the level of isolation or loneliness within your county. Then we have our community level social engagement indicators. So those are concepts related to the social engagement on the community level. So you'll see on your screen, one of our indicators is around the percentage of volunteering. And all of our indicators are, you can look at how does this compare to the national and also the state level, which I think is really important, especially as we're talking about the Wisconsin kind of context, to think about how does my county like measure up or kind of compare to other counties in Wisconsin. And then the third level is around the broader policy and systems and environmental indicators. So those are concepts related to the influence of environment, system, and policies determined by governments and organizations. So collectively, as I mentioned, these data points can provide some understanding of the condition of social connection in your county. They might suggest underlying factors contributing to the condition, and they could also point to places for change. So I think in one of the groups I've talked to, the rate of access to libraries in their community was actually super, super low. And I think as we have seen in the chat, libraries are a place for community to come together. And so they're now talking about what does it look like to actually advocate to our state that we need a local library in our community. So for each indicator, as I mentioned, you'll see how it relates to social connection. We have these nice kind of descriptions on the right-hand side of all of our indicators that talks about kind of how this kind of the why we chose this indicator to include and how that contributes to social connection. And then I mentioned the benchmarking as well. Kind of the green means it's better than compared to the benchmarks of the national or state, and then red means that it's slightly lower than the state or national. We also have sections in the data dashboard where it's about deepening your understanding. These are tips and references to dig deeper. And they also include, for example, any complementary local data or additional considerations for specific populations. I talked about the different priority populations in our data dashboard. I think it's really important, and I think we all know that there's specific segments of our populations and community that experience disproportionately high rates of isolation, loneliness, or potentially both, so disconnection. And so we want to kind of make sure that as we think about interventions, that we're thinking about specific populations. In step three of the guide, I mentioned our community listening session. We also have our partnership mapping exercise. And this is where I really think there's some incredible kind of reflection and also opportunity. And so what you'll see on your screen is actually a screenshot of the activity that is within the guide. And you really start from the left to the right. So kind of naming some key partners who could help you better understand the context in your community, what here you want to consider who's experiencing isolation, loneliness, or other forms of disconnection, who might understand the drivers of isolation and disconnection through policy, community norms, and infrastructure. The second is like who can help with outreach. So this is really thinking about who has the ability to connect with population segments that are most at risk for isolation, loneliness, or both. And then the third category is who can help you advance social connection. And that's through time, resources, space, the ability to inspire collective action. And I think this is where we see like kind of the most incredible partnerships between organizations. One that I love to lift up is in South Jersey. So South New Jersey, it is a conservation group that was kind of the backbone of thinking about social isolation and disconnection. And they partnered with a disability advocacy group and actually have formed this project where they're starting to make trails in the area actually accessible to those who have physical impairments that are not able to access those kind of trails. So this is really beautiful partnership. We also have our communities of practice map, which the Wisconsin Coalition is featured on. And this is really meant to kind of showcase who are the different groups that are doing this work nationally. I get emails, I can't tell you how many times a week, asking who I work in Wisconsin or I work in California. Who are other people in my context? And so it's really important to be able to point them to kind of resources, but also others that are doing this work. Because one kind of irony of this is that those that work in this space actually experience loneliness at really high rates. So, how can we kind of further connect with one another as we continue to do this work? Another part of the action guide that I want to kind of highlight quickly, and I know I'm almost at time, Suzanne, is our promising strategies for community social connectedness. So this is we're constantly adding promising strategies, but it's a good starting point if you are trying to figure out what to do in your community or you're kind of wanting to brainstorm. We have 21 different strategies right now. We're about to add a few more. And you can think about them, you can kind of sort by category, the component of social connection, so structure, function, or quality, as well as specific demographics. Here's one example of one of our promising strategies. So this is around civic engagement. And you can see kind of on the top that it was around youth, young adults, older adults. And so it was this intergenerational um, kind of intervention that was focused on volunteering. So I think I saw in the chat someone say that they had kind of this intergenerational moment where older adults and younger adults were having kind of enjoying themselves like at equal rates. So this is just an example of one intervention that is kind of happening right now. I will say that we are constantly adding. And so if you have interventions that are happening in your community specific to social connection, we would love to hear about them and add them to the guide. So I will drop my contact information at the very end of my session, but I just wanted to kind of highlight this. And then here's another one about the built environment. So this is really about, again, impact structure, function, and quality. So three aspects of social connection. And the kind of policy systems environment change here is really around the environment. Here's another. This is around technology access, so increasing access to broadband and digital literacy. So again, this is an intergenerational intervention, and internet access can really help reduce loneliness, improve well-being, especially among individuals who are older, disabled, or live in rural areas. I will put a big asterisk here that I think we all know that technology, if used in kind of as a replacement to social connection, can be very detrimental. But we can also think about technology and internet access as really additive and kind of in enabling connection. And then the last kind of part of the guide that I will highlight is our communities in action page. So these are stories of communities that are actually using the guide or parts of the guide in practice. So we have some friends in Lackawanna County, Pennsylvania. And so this is just the story of what the partnership was between the United Way and kind of other organizations. There's actually almost 30 cross-sector collaborative organizations working, including social service agencies, healthcare organizations, and government. And the initiative is really coordinating systems and they're beginning implementation in a 3-year pilot period, which includes quantitative and qualitative data that's going to be collected to kind of assess the impact and continuous improvement needs. So what's next for the action guide? So we're constantly refining and kind of making sure that content really aligns with the needs of local leaders. We are improving user experience and accessibility. Recently, we just added a search function so that you can actually go on and kind of in the top right-hand corner search for specific parts. So if you're looking for our promising strategy page, you can put that into the search bar. It'll take you directly to it. We're also planning our 2025 Social Connection Conference, and we're going to be rolling out more opportunities to work directly with us in community cohorts in 2025. So if that's something of interest, please look out or reach out to me and I will get you on our mailing list. So what can you do next? You can explore the action guide, and I will make sure that all of these links also come to you in the chat. You can join our mailing list. You can invite us to present. So I do presentations like this that are kind of broad strokes, kind of overview of the action guide, but we also do more specific presentations and activations that are a lot more hands-on. And then you can stay in the know about our conference in 2025. It's going to be in Atlanta in October of next year. We're super, super excited, and we would love to see some of you there. Um, And then I just wanted to close on a kind of a note of reflection. So again, I'd love to see some answers in the chat. So what is one hope you have for how your community will continue building social connection in the next year? So one thing that I'm committed to is I am a member of my community garden, and so we are actually committed as a group to hosting quarterly gatherings in the garden, regardless of the planting season. So we just had kind of a Halloween inspired kind of fire in the garden, a bonfire where kids and adults were there. We're going to do something in the new year and then kind of quarterly. I see Rachel. I'd like to have Operational Horse Heel host more connection-based events. Love that. Kathy said increased volunteer opportunities, and I'll just keep letting those come. And I'm gonna kind of welcome Suzanne back. I know we're gonna do a couple Q&As right now too.
Yeah, awesome. Thanks, Morgan, for giving that high-level overview of the action guide, and thank you for everything that the Foundation for Social Connection does to support our communities in doing this work. So continue to drop those in the chat, but also want to welcome any questions for Morgan at this time. So any questions about the action guide, Foundation for Social Connection, any information that was shared. I'll look at the chat now. And you can feel free to either come off mute or throw that in the chat. Not seeing anything come through, but definitely really encourage everyone to check out the action guide. It is super informative, really gives that step-by-step process of how to go through and do this work. The data portion on there is great as well. And I see Morgan is going to start dropping some of those links in the chat. So again, thank you so much, Morgan.
Thank you so much. I'm gonna stick around. So if there's more questions, feel free to direct message me or kind of put them in the chat. I'm so grateful for having the space to step in with you all today, and I'm excited to hear from our panel leaders.
Awesome, thank you. Before we jump into the panel, Erin is going to launch 2 more polls. So first question, I know the steps to building socially connected community is yes, no, or somewhat. And then question number 2, I know of local organizations or coalitions focused on reducing social isolation and loneliness and increasing social connection. So give some time for everyone to respond to those. All right, probably give about 5 more seconds, seeing the responses slow down a little bit here. All right, so it looks like question number 1, I know the steps to building socially connected communities, 43% yes, 55% somewhat. And then question 2, I know of local organizations or coalitions focused on this work, 80% yes, which is awesome, 8% no, and 13% unsure. So let's go ahead now and hear from some of those local organizations that are doing this work. So I want to highlight and welcome our panelists to come up, and I'm going to pass it over to Dan Crone with TMG Wisconsin, who is going to be facilitating our panel discussion, highlighting these 4 coalitions working to increase social connections for older adults and people with disabilities in Wisconsin. So Dan, I'll let you take it from here.
Thank you, Susan. Appreciate the opportunity to be here. My name is Dan Crone, and I work for the TMG organization. I think we can start with going through each of the panelists and giving everybody maybe 5 minutes or so to introduce themselves, the organization that they work for, and the coalition that they're here representing today. Why don't we start? Ashley, you're the first one on my screen here. So would you like to start?
Sure. Good afternoon. Ashley Winch, Executive Director at Marshfield Area United Way here in Marshfield, Wisconsin. And the coalition I am representing is our coalition of what we refer to as retired individuals. We have not officially named our coalition yet because we are allowing them to kind of drive the bus and steer it, and they have not officially named themselves yet, as we're still in our development phases of the coalition in general.
Great, thank you, Ashley. Anna, would you like to introduce yourself and the organization that you work for and the coalition that you're representing?
Hi, I'm Anna Morehouse, the project coordinator and the community connector at Opportunity Development Center. And I am representing the Connect Effect, the Social Isolation and Loneliness Coalition of Central Wisconsin. And our coalition started this year based on the Social Isolation and Loneliness ARPA grant we received.
Great, thank you. Mayoya, would you like to go next?
Yes, sure. Okay, I'm Mayoya Tao. I'm from Appleton, and my agency is Longchain Senior Center. We are a certified adult daycare center here in the Fox Cities. We serve our Hmong community here from Brown County, Outagamie, Calumet, Winnebago, and Fond du Lac County. We are just very new and just starting our coalition through the social isolation grants, ARPA grants that we received this year. So we are very new into starting our coalitions too. Thank you.
Thank you for the introduction. And Sarah, hello.
Hey guys, good afternoon. My name is Sarah Agana, and I work for Noble Community Clinics here in central Wisconsin. And just like Anna, we received one of those wonderful ARPA grants. And our coalition is called Portage County Rural Community Connections. And we started probably late summer, early fall.
Wonderful. Well, thank you all for the introductions. So next, I thought, we'll each of you could take a moment to share a bit more about your coalition. If you want to just talk about some of the structure behind your coalition, some of the projects that you're working on, maybe some of the members that are also and community agencies that are also involved. Ashley, would you like to start?
Sure, I can start. So our coalition is actually made up of the members we are serving. I guess I didn't mention either. We were also one of the recipients of the ARPA funding, and recently found out that we were the only coalition also that is made up of the members that we are serving. So that I think is unique to a lot of the recipients. But we started our coalition because, the pandemic taught us the importance of social connection to people's health and well-being. And so the timing of what our goals were and the grant opportunity just kind of really married itself well. So the way that we're trying to build the coalition is offering volunteering and network opportunities for our participants to be involved in. So some of the things that we've done are had them volunteer with a backpack and school supply drive, with a program that provides supplemental weekend food packs to children throughout the school year. We've offered luncheons and other networking opportunities. And then we also had a garden project this summer that was tied to the grant, and that we offered an intergenerational component with that. And so we rented a couple of community garden beds at a local church and grew garden produce to provide to both our food pantries and then some of the families that we are serving through the food program I mentioned earlier. Do you want me to kind of go on with the successes and challenges that we've seen so far, or do you just want me to kind of?
Why don't we come back to that in a few minutes? So if we want to go on and maybe just hear from the others, and then we can circle back to discussing that next.
Okay, so just a little, I'll just tie it up a
Sure.
little bit. And so we did have just our first meeting back in May where we had 8 individuals attend to learn about the concept and the idea of starting kind of with this formal group of individuals. And we're currently at 42 members now today. So we're excited to see kind of the natural growth that we've had so far. And I'll look forward to sharing more momentarily on that.
Great. Thank you. That's some great growth. Anna, would you like to go next and share a bit more about the coalition that you're a part of and maybe some of your structure or who the members that are involved and some of the projects that you're working on?
I sure can. And one of our coalition partners is the Hmong American Center, and they were also a ARPA grant recipient. And their main project is focused on fun. It's a program that serves the elders of the Hmong population in Wisconsin Rapids and Wausau areas by promoting healthy lifestyles and supporting social opportunities. Connections include a weekly gathering to enjoy an authentic Hmong dining experience at the ADRC of Central Wisconsin in Wausau. And then the additional projects that we're focused on at ODC include the expansion of Better Together and Community Friends. It's a program that matches friends with people that have similar interests. And then the set of friends also meet up with other pairs of the friends within the organization at a monthly social event that is sponsored by a local business or organization. And that Better Together has primarily been in Portage County since the late 1980s, but the expansion now includes Marshfield, Wisconsin Rapids, and Wausau. We're also exploring the adaptive recreation as a way of connection and growing partnerships to have the ability to expand adaptive recreation opportunities within Central Wisconsin. We are starting a men's shed in Portage County. And lastly, we have a focus of increasing awareness of social isolation and loneliness that includes Media Mondays, which can be found on ODC's website and Facebook page.
Thanks for sharing, Anna. That sounds all wonderful. Mayo, would you like to share a little more about your coalition next?
Yes, thank you, Dan. So our coalition, we just started during the month that we receive grants. The main purpose of our coalition is to strengthen our services by connecting with other organizations in our community, and also is to provide better services for our Hmong or Asian community, especially our elderly population. We has gathered and also sent informations to collaboration partners or potential partners that will be having a resource that our senior population could use, the resource that they have available, so we can collaborate together. And instead of us developing whole new programs or services, we will go and find what services that our elderly population needs, and we collaborate with those partners and bring them into our coalition so that we learn from each other and our elderly can use the service that our collaborations partners already developed. So those organizations are such as like food pantries, health department, the public and city, the county and cities health department. We also are reaching out to like family cares throughout the areas because of the service that our elderly needs from family care, and also like IRIS program. We also are connecting with other senior center in the area, like the Menasha Senior Center, to like the Thompson Community Center here in Appleton, and also ADRC throughout the counties that we're working with, and letting them know about our coalition and invite them to join our coalitions. So that's what we have been doing so far with our coalitions.
Great. Thank you so much for sharing. Sounds like you have some great projects and great community partners getting involved. And Sarah, would you like to share a little bit more about your coalition?
Yeah, of course. So our coalition is focusing on our rural areas. We are located in Stevens Point, Portage County, but we've got about 4 rural areas that we really want to target. And what we are looking at and working on is doing 6 social events starting after the first of the year. So we have about 1 to 2 social events that we got to cram in because we got to use all these dollars by the end of March. The focus of these social events are we're asking all age groups to come and join us. We're promoting services and resources within these areas, and we're taking on kind of a winter carnival theme. And what we've done is just kind of let it go out to our coalition members that live in these communities to gather what we're going to do. So each community event may look a little bit different. They will have some similarities, but we really want to focus on, artists in the area, specific food or restaurants in those areas. So we really want to promote those more rural areas. And what our coalition consists of is some community members. We've got chamber members, social service agencies. Anna with ODC is one of our coalition members. Libraries, the ADRC, and this grant was written by Portage County Health and Human Services and the ADRC. Safety personnel, city, county, schools, nonprofits. So we're including just about everybody and everybody in this coalition. We've got probably about 50 members that we send out emails to, but we have got about 30 people that are engaged, and we have monthly meetings to discuss these social events that we're working on. And I think November we're in about our 4th meeting, so we're getting there. Another thing that we had written into our grant was to do a symposium that we had last week. So we did a symposium called Isolation to Connection. It was a 1-day symposium that was open to the public, and it was free to the public. So about 100 people attended, and we had 4 great speakers that spoke specific to social isolation. And it was really, really well attended. So very happy. And I haven't seen any of the comments or the remarks, but I've been hearing that they've been really good. So yeah, it's going really well for us.
That's great. Yeah, it sounds like you have a very active group. I love the winter carnival idea. So the next part that I think we wanted to discuss was what Ashley mentioned earlier was just kind of discussing some of the challenges and successes that your coalition has seen. And maybe I'll just throw this out to anyone who wants to share first. But yeah, can you talk a little bit about what are some of those challenges or some of those successes that you've seen so far with your coalition?
Can just keep us in the order and go if that works.
That works too. Okay. Yeah. Ashley, would you like to start then?
So some of the successes that are attributed to what I think has been a really great steady growth. We're happy with having 42 members in about 6 months, maybe a little bit less than that, but things that we have attributed to that would be the quality of the experience for our members. So continual communication from us, and then also what we have found to be really working is just the reassurance that there's room for everybody regardless of the ability. And so kind of one example I have of that is for the community garden project. We had a woman who physically wasn't able to go to the garden, but we did square foot gardening, which none of us had ever done before or knew anything about around here. So we've been learning a lot too. But that was something that she had done before, was very well versed in, designed our gardens. She came in after that process and shared the designs with us and cried because she is at a point in her life where physically, she has some limitations, but she's sharp as a tack. Her mind is there. And she was always somebody who was really involved in our community and has not felt a sense of purpose. And this was her first feeling of that in a really long time. And so that was one of our very first experiences of any sort of feedback, because it was very early on. And so it was like just all that reassurance that, we are traveling down the absolute correct path with starting this coalition. Another thing is when we introduce an opportunity or activity, just again, reassuring, like, if standing isn't for you, we have accommodations, we can sit, we can do. So always just keeping the great communication open, and then just about the experiences in general, but then for when the experiences are coming. So making sure that we're really super organized. So when we have an activity or an event, that we have something that they can take home with them to remember for the next opportunity. And then we've been really good about asking their way of preference to be communicated with. Some people like to receive text, some people like email, some people don't do any of that. And so we're calling them. I will say also there has been no pressure to commit to anything at all. Again, why we haven't officially kind of given this group its own name, because we're letting it kind of happen as it is. And so just making sure the offerings are there and that they are being communicated well, but not putting any pressure or any sort of sense of commitment for them. Just letting them really kind of guide, I think, has been what has attributed to a lot of our success. Some of the challenges that I think that we've seen so far, who are we not reaching? And so I really appreciated the partnership mapping. I think that would be advantageous for us to go through that process for ourselves and work on some partnerships so that we can find the people who are not reaching, that we would like to offer invites to join the coalition itself. And then staffing for our organization has been a challenge. We have been short-staffed the majority of the last 6 months. We have since we are currently, for the last 3 weeks, fully staffed. So we're really looking forward to kind of putting on the accelerator a little bit with things now that we have a full staff of employees. And then for our project-related challenge, when we did the gardening with the intergenerational component, scheduling with the intergenerational piece with children, because we know how busy the summer months are and kids are at camps, or there's so much crammed into a summer for families and kids to do that. Scheduling was difficult with that piece. And so I think that's something we want to work on organizing a little bit better for our next gardening season next spring.
Thanks for sharing, Ashley. Anna, would you like to share about some of the successes or challenges with your coalition?
You bet. I forgot.
Oh, I think you might have frozen. Can you hear us okay?
Can you hear me?
Now I can.
Okay.
Yeah, sorry, I think you might have cut out momentarily, at least on my end.
No worries.
Are you able to share, about some of the challenges, any of your challenges or successes that your coalition has seen so far? I don't know if it's audio on my end.
Yeah, it's frozen on my end too. So maybe we'll come back to
Okay.
Anna.
Okay, maybe, yeah, Anna, we'll come back to you. I think you're frozen again. But Maya, would you like to share?
Yes, thank you, Dan. So it's been a struggling for us. However, some of the success that we see and that happens during our coalition is it shows us that it's really interesting the collaboration partners that we invited them to join our coalition. It's something new and something that hasn't been happened before in our community. So our collaborations partners are very happy and wanted to be involved and wanted to help us and just be a part of our organization. The success of our organization so far is um, some of the organization or collaboration partners. We so outside of the coalition, we also work on other projects like getting grants to help buying blood pressure cuff that we can use at the adult daycare when the adult comes in, and the elderly come in, and we do a blood pressure check. So we were able to work on that on the side out of the coalition. We were able to take them out together as a team to do like a bus tour, riding the city bus. We were able to um, like do other activities outside of the coalition, but involved with the coalition partners. One very big success that we saw is um, we were able to. It took us 2 years to very work really hard with our county here, Outagamie County ADRC for the meals. It's called Congregate Meals, and we finally able. It took me 10 years to talk about it, 2 years to really push it, and now this year it happens. And we were able to get funding through ADRC for a congregate meals every Tuesday for our elderly who are 60 and older, and they're eligible to come in to get meals with a donation fees that they're able to donate. And that's a very, very successful um, um, collaborating work that we did together. And so, and challenges, although we are, everyone is very interested of our coalition, but it's really hard to find a time to meet. And every time we send out a schedule for meeting, only one or two organizations that responds that they can meet, and then we're like, oh, what can we do to solve this problem? Because we really want to meet, we really want to share resources and see what's out there and what we are doing and what they're doing so that we can combine those resources. So now it's been like a couple months now, we cannot get a meeting together. And I believe we are having one this coming Monday. And there's, I believe, 8 or 10 collaboration partners going to join. So that's our biggest challenge, is finding that meeting time. And so for future, to meet our challenge, we thought of probably just set like a quarterly meeting or a monthly meeting, it that designate time exact and say every first Thursday at 9 a.m. If and then send them like a reminder email and log into, the site or the link. So that's something that we have been talking about. So those are our success and challenges.
Great. Thank you so much for sharing. Anna, I see that you're back again. Do you want to try again?
I can definitely try again.
Okay.
Can you hear me?
Yes.
Okay, great. So for our coalition and our projects, the areas that we're serving and partnered with are around Portage, Wood, and Marathon County. And so having such a large geographical area in a small amount of time has been a bit of a challenge. But we have strengthened relationships with partners as we continue to reassess the goals we want to achieve by the end of the grant period. And as far as success, I would say just with the growing awareness of social isolation and loneliness, both at state and local levels, and having multiple grantees within the service areas Sarah mentioned, there has been a strong sense of commitment created. And for example, for the Men's Shed, we do have a subgroup that meets just through the grant period, but we have started to form our steering committee who will be responsible for long-term decision-making post-grant. So it's great to see that support is going to move forward past this grant period.
Thank you, Anna. And Sarah, we'll end with you.
Awesome. Well, hopefully, I know I'm in central Wisconsin, so hopefully I don't freeze too. So like Anna did. So yeah, I think, definitely successes are how many people we have within our coalition and all the people that are interested in this cause. We definitely saw that with our symposium that we just did last week, where we got a whole, I think, another like 80 different people that can be involved in our coalition that probably didn't even know we were part of a coalition. Maybe they thought we just put on this symposium. So it'll be exciting to see the coalition grow in numbers with just the variety of people. But I still think, something that we probably need to work on is, are we still missing some people? Like Ashley said, is there people in the community that we haven't targeted, that we haven't asked? Our county is pretty big and pretty rural. So are there those people more out in the rural areas that we really should be talking to? Some of the other, struggles is, how are we going to continue these events for next year? We can continue to do it. We've got the grants to do it, but can we get these rural areas like Almond and Junction City to maybe do these events from here on out and continue to have that growth with these great community events that we're organizing? And then just personally, when we were looking at actually doing these events, finding community space in these rural areas has kind of been a challenge because there's not a lot available, not a lot available indoors for that matter. And unfortunately, we have to do these events in the winter. I wish we could have done them in the summer because it would have been, to me, much more fun. I'd rather have like a Hawaiian beachy theme than a winter carnival, but that's just me. So just finding those locations, and it's been interesting reaching out to these rural areas and just finding those key players that'll help us, with these events. So I think it's overall been going really well.
Great. Well, thank you all, and thank you all for being here to share about your coalition. We're excited to see the progress in the coming months. Unless there's questions for the panelists, Susan, I can turn it back over to you.
Awesome. Thanks, Dan. And thank you all for sharing about your coalitions, who's involved, challenges, successes, and we'll be excited to kind of see what happens with all of those moving forward. Well, everyone's thinking of questions. We're going to launch one more poll for the day. Give some time for Erin to do that. So the question again, I know how to get involved with a local organization that works to reduce social isolation and loneliness. So I'll give some time for people to answer that. Like those responses are slowing down a little bit, so I'll give a couple more seconds. All right, so about 87% of us say yes, 9% no, and 4% unsure. I wanted to share a few resources before we jump into Q&A. So we just heard from 4 great examples of the ARPA grantee coalitions. So if you're not aware, the Wisconsin Department of Health Services American Rescue Plan Act, or ARPA grant program, was intended to fight loneliness and make communities more livable for older adults and people with disabilities. So 37 total awards were made in May of this year for 2 grant programs. So one being social isolation and loneliness, which was awarded to various public and private organizations to create effective ways to help people feel more connected and less isolated. So these efforts aim to improve services and conditions in the environments that support older adults and people with disabilities to live well in their communities. And then there was the Livable Communities grant. So that grant was awarded to support solutions for people to connect, get around, or stay engaged with greater ease. So the goal of that grant was to improve the built environment where older people and people with disabilities live, so they can be independent and be involved in their communities longer, avoiding the need for expensive care or moving away from home. So really encourage you, if you haven't connected with one of the ARPA grantees already, Erin is going to drop a link in the chat. You can see on the screen here where those grants were all awarded, and you'll see on the website as well. If you're interested in getting involved in a grantees project in your community, the contact information for all of those is on that website. You can also contact your local Aging and Disability Resource Center or your public health department. Oftentimes, those agencies are kind of driving those local community coalitions in local counties. A couple other resources I just wanted to share briefly. So UW-Madison Division of Extension's Health and Wellbeing Institute has a new regional community health team that provides technical assistance and capacity building to local and tribal health departments, community-based organizations, and coalitions in support of community health assessment and planning processes. They are a great resource. Community Toolbox, they offer practical step-by-step guidance and community building skills and have some toolkits that they offer short outlines for key tasks. And the County Health Rankings and Roadmaps. So this program highlights policies and practices that can help everyone be as healthy as possible and aim to grow a shared understanding of health equity and the power of communities to improve health for all. So I encourage you to check out some of those resources. Erin is going to drop links for those in the chat as well. And also encourage you to check out the action guide that Morgan shared at the beginning of the presentation. So we do have some time for questions now, so I encourage you to turn on your camera at this time, but please continue to remain muted unless you are talking, and you can put your questions in the chat or come off mute. I did see one question in the chat about what the geography is of Sarah's coalition, and I see that, Sarah, you responded to that, but they are located in Portage County in central Wisconsin. I'll give us a little bit of time here for other questions to come in for our panelists. Okay, well, not seeing anything come in. Again, you can look at the Department of Health Services website if you're interested in learning any more from any of the 4 panelists that were awarded one of those grants. Their contact information is on that website, and you can reach out to them to get more involved. And yes, the slides will be shared with attendees. So bringing us into our discussion portion of today's webinar, I encourage you to stay on and connect during the Social Connection Awareness Week. We are going to do some speed networking. So this conversation is all about coalitions, community building, networking, and sharing with each other, building relationships. So in a minute or so, Erin is going to put us into breakout rooms. We'll have 4 or 5 people per room, and we'll do a couple of rounds of this. So we'll do about 6 minutes in each room, and you can share your introductions, your name, organization, quick icebreaker, maybe your favorite fall drink. Are you involved in any community coalitions on this topic? If yes, how is that work going? And what does your organization do to promote social connection for older adults and or people with disabilities? Okay, I think we're all back now. So is anyone willing to share about that? Did you meet someone new? Did you make a new connection? How was it?
I can share. So I'm from Inclusa, which is a managed care organization, and we normally get our referrals through the ADRC. So I actually got put in a room with Michelle from the ADRC in Brown County and found out that they have a grant through the Neighbor Works group in Green Bay. So we discussed how we could support our members through different grants in their community.
Awesome. Yeah, that sounds like a great connection. Thanks for sharing, Trisha. Anybody else want to share? I saw some thumbs up when we came back, so that was good. All right. Well, hopefully you met someone new and had some new connections. I'm going to wrap us up. We're almost towards the end today. All right. So again, really challenging and encouraging you and giving you guys homework to do this 5 for 5 connection challenge from the Surgeon General. This was developed as a way to make intentional connections. So picking 5 actions for 5 days and really being intentional about a simple action every day. So either expressing gratitude, offering support, or asking for help. So again, you can call or text someone, let them know that you're grateful for them. thank someone for a specific time they helped you, check in with someone, reach out to professional mental health support for yourself, or let someone know you're having a hard time. So Aaron will drop the link for this in the chat. Again, if you haven't had a chance to look at this, you can write this down on a notepad. You can put this in a Word document, but sharing, making a plan for how you to connect each day and then how the connection made you feel. So again, I'll share mine each day. So my plan for today is to compliment a stranger. I haven't really left my house much today yet, so I'll plan on doing that sometime this afternoon. But last night, able to celebrate my husband's half birthday a little bit. Came home with a little gift for him. He was kind of surprised. So it was just kind of fun to do. And anyone that knows me knows I love birthdays. So that was something fun. So making a plan to do this and strengthening your own relationships and inspiring others to do the same. So again, feel free to join the Nationwide Network of Champions. We have our own Wisconsin community on there. You can learn from others. The link for that will be dropped in the chat as well. I encourage you to visit our social connection website, connectwi.org, and find all of the resources on there as well. And really asking you as well to complete the evaluation for this webinar, which will open in your browser after you close out. So thank you all for staying in until the very end and participating in some of that speed networking. Hopefully you had a chance to connect with others and learn something from our speakers and panelists today. And again, the recording for this meeting will be sent out within the next week and also will be made available on our website. So hope to see you back tomorrow for our conversation about intergenerational connections. If you haven't registered for the rest of the week, so for Thursday and Friday, the link for that will be in the chat and also on our website. Thanks, everyone. Have a great rest of your day.
Thank you.